everybody, I'm Dr. Pathak from Pathak Dental Clinic, and today we are going to talk about one of the most important topic, that is crown cap after root canal treatment. We all know that root canal treatment is one of the most common treatment that is being done in any dental clinic. सबसे common treatment है, इसलिए सबसे important भी है. Now the question comes when most of the patient they comes, they have this question in their mind that should they go for crown or the cap after root canal treatment is being done. So mostly we all know, all the dentists, they often give a good advice to their patient that yes, they should go for a cap, because after performing a root canal treatment, the tooth becomes brittle and there is a probability that your tooth may get fractured after having any hard food item. So cap definitely. After root canal treatment, we always suggest, I'll tell you, advice to the patient that please go for a cap. Now patient have this question again in the mind कि कौन सी cap करनी चाहिए, which cap is good. So depending upon your budget, you can go for any cap. Now there are metal cap, there is ceramic cap, there is CAD-CAM cap, फिर zirconia है, emax है. So depending upon your budget, depending upon your comfort, depending upon the treatment, or depending upon how good you need a thing, because see what happened, basically we are very keen to spend money on other things. I often say the patient that हर अलग चीज़ों में हम लोग पैसा खर्च करते हैं, but when it comes to ourselves we try to save it. So whenever you decide for a cap, make sure that you take the advice of your dentist, because they are going to give the best possible advice regarding the cap or any treatment, and it's going to stay for a longer period of time. ऐसा नहीं कि 1 साल में बदलना है, 2 साल में बदलना है. Cap is going to stay in your mouth, you're going to eat up with that tooth. So make sure whenever you select the cap, it is the best possible cap. Definitely metal cap you can select in the upper posterior region because it is not that visible, but in the lower, always try a ceramic cap. For comfort and for precision, CAD-CAM caps are always better than normal metal and normal PFM. Zirconia or emax cap we usually advise patient in the anterior tooth. Definitely it has got the strength to sustain in the posterior tooth, but over a period of practice and experience, we usually prefer CAD-CAM PFM in the posterior and advise the same to our patient. Now the third question that patient has, that कि cap तो निकल नहीं जाएगी या cap तो खराब नहीं हो जाएगी. See, there are certain instructions to all people after fixing the cap, and every dentist will make sure that the cap is properly placed. Avoid eating sticky food items like chewing gum, eclairs, 5-star, or anything that sticks in between your teeth. The third question is, sometimes the food gets stuck inside your cap or between your teeth. Now this happens when the cap, the placement of the cap on the margin, it may differ, or it depends upon from practice to practice. So that is also important that you place your cap properly, thereby maintaining the biological width and making sure that it has been covered on all the aspects. But sometimes recession or the bone loss may occur due to other periodontal condition and may result in the gap between your teeth and the cap, letting the food particles getting stuck between your teeth. That's very common thing. And make sure you visit your dentist for proper follow-up of root canal treated tooth. Once you are done, it doesn't mean that you will not go back and visit or consult your dentist. Go after every 6 months or 1 year, see the condition of your root canal treated tooth and the cap. Make sure you eat healthy food, and make sure that you keep smiling. And if you have any doubts, any questions about any of your dental treatment or dental related issues, please visit us on our website www.pathakdentalclinic.com, or you can call us and visit us at Pathak Dental Clinic